Hi, welcome everyone to the World Health Network Town Hall. Today is Friday, April 25th. It's 1 o'clock here on the Eastern Coast, New York time. Today we have a special guest, healthcare advocate and cancer survivor, Laura Packard. We're really grateful to have you with us today. And returning is our epidemiologist here at World Health Network and co-founder, Eric Feigl-Ding. So today, we're having an updated discussion on the continuing breakdown of the US healthcare system. We'll be talking about looming drug tariffs that are possibly on their way. We'll be talking about the Congress annual budget and some serious Medicaid cuts that are on deck there. Laura will be covering that for us. We'll also be reviewing the measles outbreak that continues to worsen in the area. And as always, we love to take your questions. So if you do have any questions at top of mind on these topics or related topics, I welcome you to put them in the chat and I will raise those questions to Eric and Laura. But for now, I welcome all of you to turn on your videos so we can have a more interactive experience. We love to see all your faces. If you're comfortable with that, we would love to have your video on. And if you don't mind, just putting your location in the chat. It's always nice to see where everyone's calling in from. Thank you so much for joining us on this. Well, it's a beautiful Friday here in New Hampshire. That's where I'm calling in from. So um, it's wonderful to have some spring weather after a long winter.
Oh,
Uh,
yes.
yeah, so thanks for turning on your videos and thanks for putting your location in the chat and take a moment to locate the chat so that you can type in your questions as they arise. Thanks everyone for joining us here at the World Health Network. So, hi Laura, thanks for joining us. We have a question. So you had mentioned that there's the annual budget being developed right now in the Congress, and we're really concerned about what's being written in on Medicaid. So let's start there. Could you tell us what's going on there?
Sure. Well, let's start with what is Medicaid, since some of the audience may not be familiar. Medicaid is a program that covers people with disabilities, pregnant people, seniors in assisted living and nursing homes, working class families that don't have access to health care through their jobs. It's a social safety net program that actually covers more people than Medicare does, which is the program specifically for seniors. So Medicaid fills in the gaps and it covers millions of people across the country, and it costs money. And right now, Congress is working on their budget, which they're using a process called budget reconciliation so that they need fewer votes in the Senate. It could take a long time to explain how the U.S. Government works, but they're using a special procedure so they need fewer votes. But they still may or may not have the votes to do this. The reason why they're looking to cut so much money out of the budget is they want to pay to extend the tax cuts from the previous Trump administration that is aimed primarily towards the wealthy. So they need to find trillions of dollars in cuts to pay for these tax cuts. And where one of the places they're looking to get that from is from Medicaid. The budget blueprint, which is not the actual budget, but the instructions for writing the budget, had over 800 billion in cuts. And that's nearly $1 trillion that they would take out of this social safety net program, which the states could not possibly backfill that much money if it gets cut. So if they succeed in doing this, it means millions of Americans will lose their health care. And these are people that can least afford to go without health care. These are, low income Americans, people with disabilities, people that are pregnant or just had a baby. Uh, Understandably, many of us are concerned about these possible cuts and what that would do to public health in America.
Yeah, thank you. Does anyone have any questions about these cuts? I actually do have a question. I understand Medicaid programs, I believe, are arranged by state.
Mhm.
It said that the states can't backfill, which means they can't make up for the funding that they would lose from the federal government. Do you know approximately how much money goes in? Is it like a 50-50? Like, does the state have their own funding, and then the federal government fills it in, or can you speak to that?
Well, how wonky do you want me to get? Because traditional Medicaid is has one split between Medicaid is a federal state partnership. Traditional Medicaid has one split. The Medicaid expansion, which was a part of the Affordable Care Act, which was passed into law in 2010 and then rolled out over the next few years, that has a different split for this different population of people that's also covered under Medicaid. So the traditional Medicaid is people with disabilities that qualify, that are able to jump through various hoops to get access to Medicaid. So just because you have a disability doesn't mean you have to go through all these processes to get it. The first 3 months of pregnancy, I think, and seniors or other people in nursing homes that need long-term care. And the Medicaid expansion as a part of the Affordable Care Act was a way to get America closer to universal coverage. So Medicaid expansion allows for low-income people to be able to get Medicaid as well. So it's gig workers that maybe have multiple part-time jobs or just low-wage jobs that don't provide health care, or caregivers, people that are going to school, all the reasons why you wouldn't necessarily have employer health care. Medicaid expansion fills in those gaps. That's a different split in how much the federal government pays for and how much the state pays for. And part of there were incentives for states to expand Medicaid that was a part of the Inflation Reduction Act and the American Rescue Plan. Uh, you could call it a bribe. It's an incentive to get states to actually expand Medicaid to cover the millions of Americans, the working Americans that need this. They offered a better match, a better federal match, FMAP, for this Medicaid expansion population. And note there's still some big states that have not expanded Medicaid. There's about 10 left, including gigantic states like Florida and Texas and Georgia, still have not expanded Medicaid to this working class population for political reasons. But 40 states have. Just about every state has, except for these 10 holdouts. Um, was that too wonky? Wonky enough?
No, those are really helpful points. So is the budget proposing eliminating the expansions?
the Because we haven't seen the budget yet. They're in back rooms writing the budget right now. And theoretically, Monday, March 5th, I think, is when they're going to start possibly marking it up in committee. But it'll leak before then. So sometime next week, we'll find out which rumors are true. And
Mhm.
how you gut nearly $1 trillion from these programs, are a lot of ways. You can screw the states, say we're going to change the matching percentage, and you have to either come up with the money or kick a bunch of people in your state off of healthcare. They could increase the requirements it takes to get enrolled. They can, the more hoops you put in front of people, the more people will drop off. And we know this because in Arkansas, they established work requirements where you had to prove that you were working or you had a good enough excuse, according to the state of Arkansas, to not need to work. But to do all that, you had to call in, send in paperwork, etc. And they dropped off thousands of people from healthcare that should have had it, that were eligible, that just couldn't jump through all the hoops. Because again, if you're a caregiver, if you are in assisted living, you may not have the capacity to fill out these forms or the time to fill out these forms. If you're a very low wage worker, do you have good internet? Do you have mobile phone? Do you have to find a public library if you're in a rural area that's maybe an hour away? If you don't have transportation, how do you get access to the way to prove that you should be eligible? And as somebody in chat said, if you don't speak English very well, these forms may not be easy to navigate. So they're planning, if they go the way of work requirements, they're going to save money by kicking people off of healthcare. And we know from experience, most of those people meet the requirements. They just can't get through all of the paperwork.
Mhm.
So that's one thing. So they could change the federal match. They could establish work requirements. They could just cut budgets. They, just cap how much Medicaid pays to the states or various other things. And we don't know how they're going to get their over $800 billion in cuts until we see the work next week, probably.
Yeah.
Could they also block grant? I heard just like give like a fixed amount to each state, and if you just give each amount to each state, then it comes down to each state how they want to spend it. And of course, some states will kind of make it the roadblock, as you mentioned, for
Mhm.
work qualifications as difficult as possible, right?
And also, if they block grant it, they might block grant it to last year's numbers, or like they want to save money here. So the only way you save money out of Medicaid, which actually has a lower percentage overhead than even Medicare, the only way you save Medicaid is cutting people. So they want to establish things that make it harder to get Medicaid, to keep Medicaid, or the amounts of money going to the states to pay for Medicaid. And if they do block grants, it probably will not increase with inflation. So it will be a cut, just
Okay.
disguised not as a cut.
Right. And it'll depend what kind of state do you live in, right? An easy to obtain
Exactly.
state, or is it going to be a super difficult state that makes all the barriers super high?
Yeah.
Right.
And
And
there
if it's a block grant that they have any kind of choice in how to spend it, you can just look at what Florida did. Information just came out that the governor's wife got. So a settlement with Centene about insurance wrongdoing, instead of paying that back to the taxpayers of Florida that were fraudulently, that paid too much to this insurance company, instead, millions of dollars were sent to a dark money political group controlled by the governor's wife. So again, if governors and state legislatures get control of the purse, they may or may not spend it on the healthcare in which it's designed.
there was a comment in the chat about folks being blindsided by this, and there Aurora had mentioned that there's states that have alternative names to Medicaid. So maybe it might be helpful that we name a few just so that the folks listening and the folks that are going to be watching our replay understand maybe for their own understanding.
And
Yeah.
that's another unfortunate thing is for a variety of reasons, a lot of these states don't call their program Medicaid. So many people may not be aware that they are on Medicaid and their health care is being threatened because in Wisconsin it's called Badger Care. In California it's called Medi-Cal. It's called Denali Care in Alaska. Like each state has their own little tweak to it, perhaps because Medicaid had a stigma or it has had a stigma because it's for low income people or people with disabilities and so on. So the states rebranded it as other things, but then we get to this point where people may not be aware that their health insurance is at risk because it's called something else in their state. So exactly. Somebody's put in the chat that, people with protest signs, keep your government hands off my Obamacare. And just the fact that things are called different names, people may not be aware that the thing that is providing health care for them is this thing that is under attack.
Yeah, thank you. Let's see. I'm just checking the chat to see if we covered everything so far. Well, there was a question by Lauren, what can folks do now to try to help sway the government in a different direction?
If you are an American, you should absolutely call your two senators and your representative and make sure they know that you don't want them to cut Medicaid and you don't want them to cut Medicaid overtly and you don't want them to cut Medicaid sneakily. So that means no caps, no onerous requirements, no changing the matching funds. So don't cut Medicaid, period. You may try to dress it up as something else, like the latest talking point is waste, fraud, and abuse, but that is an excuse because you cannot find $1 trillion of waste, fraud, and abuse in this program. So again, that is an excuse to gut the health insurance that millions of Americans are relying on.
Yeah.
Is it going to affect the Medicare also?
Not directly, indirectly, because Medicare and Medicaid are separate programs, and Medicaid is administered by the states. Medicare is a federal program.
Federal, yeah.
But people may not be aware that there are millions of Americans that are dual eligible, that have Medicare and Medicaid, low income seniors, or if somebody's in a nursing home, Medicaid only pays for short-term stays. So if you're in a nursing home long-term, at a certain point, that switched to Medicaid. So we could have a nursing home crisis on our hands if Medicaid is gutted. And then what happens to people if nobody is paying for their care?
Yeah, thank you. So let's maybe switch topics if you feel like that's a decent coverage. I think you covered and educated us a lot on what is behind closed doors. We'll be looking forward to seeing what happens next week. Well, maybe not, I shouldn't say looking forward, but eagerly awaiting.
And this is not done, by the way. This is
Yeah.
it's going to be very close. They may not have the votes. Just like in 2017 when there was a strong push to repeal the Affordable Care Act, in the end it failed by one vote in the Senate. This is probably going to be another one of those kind of fights where it's going to come down to just a handful of votes. And they want to gut Medicaid, but they may not be able to get the votes to do it. So call your representatives.
Thank you. All right, let's move to those looming drug tariffs. And just a reminder for all participants, just to put your questions in the chat and I will elevate them to our guests here. Okay, so Eric, drug tariffs, what's the word? Yeah.
Drug tariffs are I know tariffs has been the topic that has rocked world financial markets and caused everyone to hate America right now, above and beyond everything else that's already happened. But when it actually hits people's pocketbooks, 401ks, the chaos in the stock market is because of this back and forth. yes, there will be tariffs. No, there won't be tariffs. Yes, there will be even higher tariffs, especially on China. And then this escalation of now we go from like 50 to 100% to 125 to now 145% tariffs. And they'll come down. That is the thing. Now, the one thing that has not been tariffed so far, they've tariffed everything from durable goods and a lot of steel and aluminum. But the one thing that's kind of like been kind of exempted because there's a World Trade Association treaty signed many years ago. This WTO treaty specifically says that all the country signers will ban and exempt tariffs on the majority of pharmaceutical products and substances, raw materials to produce these medicines. And U.S. is the signer of one of those treaties. But treaties can be ripped up and can be, basically pulled out of, which has happened many times before, especially under Trump administrations. And I think this is what they're going to do next. They're basically going to rip up this potential treaty. And it's going to come in a month or two. But this is the thing where, the U.S. does not produce the majority of its medicines or many other medical instruments. By the way, one of the top imports in U.S. ports is actually X-ray machines and medical instruments like ultrasounds and surgical equipment and medical equipment, especially these medical one-time use. There's some things you can repeated use, but some one-time use things they use in hospital, they're all made in China or in India, basically. But majority of them, especially those are made in China. But medicines, Ozempic is actually a Danish medicine, which is going to be very interesting if we want to take over Greenland, by the way. But aside from that, the vast majority of medicines are made overseas. And we already pay 2 to 3 times more for prescription medicines right now without the tariff chaos above other developed countries. Half Americans can't even afford it. But now if you compound the fact that Americans pay 2 to 3 times more already with added tariffs that we would have to absorb that, other countries in England may not, then we're in deep doo-doo because the manufacturing costs will increase. Manufacturing of medicines is not as simple as manufacturing a widget. It has very high requirements, and we've had many situations in which U.S. factories, like the Emergent, remember how like during the pandemic, Johnson & Johnson doses, like 100 million doses of Johnson & Johnson vaccines produced at this Baltimore factory by Emergent Biosciences, had to be like, they were contaminated and poor quality and were repealed. It's not easy to manufacture medicines. And the cost will only soar if we tariff. And there's actually stats that say of the raw materials, even if we try to produce them in-house here in the US, the raw materials for these medicines, these chemical compounds, 60 to 70% of them are made outside the United States.
Yeah, I
And
think India also sends a lot of the raw material.
Yeah, exactly. India
yeah.
and China are the number one
India and China.
producers of these raw materials. And they're also the number one providers of antibiotics. So even if we talk about like high tech, if we talk about basic medicines, antibiotics, and many common medicines that's been around for decades, those are majority made in either China, India countries. And some countries are not high tech enough to make them because they're, that's why, iPhones are either made in India or China or Taiwan, because these semi high tech but high cost to manufacture were usually made. All of these are on the chopping block, or not chopping block, but basically on the tariff wall that's coming. And I think we will face shortages. If we face shortages of these medicines, it's gonna be very, very bad. Like, I don't need to say how bad, but it's either going to be shortages bad or cost bad. I think there's a stat. I think 80% of remdesivir, drug that was very common actually depends on China, for example. And I think a lot of these drugs, many of these drugs specifically, and there's already, like, in the list, Trump administration has 300 drugs that's potentially on the Trump chopping block for tariffs, for restrictions. How do we know this? Because this is from the first Trump administration, um, that back in 2020, he actually his administration published a list of basically 300 drugs that they want to tariff. So we're gonna basically see a lot of, and there's already a momentum to say we don't want China to be the leader of this. Yes, fine, we can, but again, the whole problem with tariff is if you try to tariff it up, what are we going to do in the immediate run until we produce our pharmaceutical supply chains, right? And the issue is these are, again, not simple factory widgets. These are very advanced factories to manufacture, FDA approved safety drugs. So I think we're in a world of hurt if this happens in the next month or two. And we do think it's going to definitely happen. This trade war is only starting. And right now we're just at the very tip of it.
Yeah, the trade war and then the way they treated Zelensky, the VP,
Well,
then Potus. So
I was-
another third world war. So
Excuse me,
Shankatala, sorry. Yeah, let's let the speakers speak. Thanks, Shankatala.
we just have to make the comments in the chat for the purpose of our town hall and recording. Thanks. So, Nikki, I think you were asking, I saw you asked, what is it used for? I was just wondering if you were asking about remdesivir, possibly.
Oh, remdesivir. Remdesivir is one of those drugs that it's an antiviral. It has limited efficacy for COVID, but we used it a lot in early pandemic because it was already on the market for many like flu, respiratory kind of things, and then we kind of repurposed it for COVID. But there's a lot of these drugs. Also, like Tamiflu. The majority of Tamiflu is imported, I think, from China as well, and India. So all these like drugs, like pandemic prevention drugs, we can't make them overnight, like snap it to a U.S. production overnight. These are not easy drugs to manufacture. Pharma factories are very, very among the highest, most difficult things to manufacture.
Sure. Yeah. And then there was also just a request, and I just want to clarify from Aurora that we put a list on our WHN website. I believe you may be referring to the list of drugs that could possibly be tariffed. And I think Eric was referring to an old list.
I was referring to an old list. The thing that we're in a brave new world. I don't want to pre-jinx it. And we'll see the list when they come out. But I think what happens is once they come out, like right now, it's too early to do advocacy to say, hey, don't do this, because the list is not even out yet. But I think it's one of those things we're trying to it's kind of like chance favors the prepared mind, and we want to be ahead of the curve and see around the corner of this crisis that's inherently gonna, just like the budget. We don't know the details of the Medicaid budget cuts yet, right, Laura? But we know it's going to be bad.
Yeah.
And we have to prepare for this eventuality.
Yeah, Sally
Exactly.
has a question about implication for vaccine availability outside of the US. I don't know.
Well, outside the US, it should still be okay, right? This supply chain should be okay. There might be even more medical tourism if this happens, right? We go to Canada and or other Mexico or other inexpensive countries. Just be careful when you come back. Get a burner phone, as we sometimes joke.
Right. So, are there other Health and Human Service problems that you want to highlight today that are in the news? Or
Well, how much time we have?
Well, we have a half
There's
an
a lot.
hour.
There's a lot. Like, how about Laura? How about you?
Mhm.
What are your current major peeves that you're worried about? I know HHS. It's I can talk about NIH. I can give you horror stories from NIH, but let's cover what decimation right now bothers you the most in the HHS that we can
Well,
maybe.
I think relatively recently they said they wanted to cut a quarter of HHS, and
Right.
again, the effects of this on public health are going to be felt for decades. Like not only the research that is being halted right now, but the people that are getting discouraged from even going into public health or medical research. That if you're in school right now, it's not an appealing field to do that here in the United States because your job, your livelihood's going to be at risk. And other countries can only step up so much. Certainly, researchers who've gotten their projects cut here, some are being recruited by Europe and other places, but the rest of the world can only backfill so much because the United States is the number one driver of medical research and scientific discovery. So there are so many issues with HHS and RFK Jr. in particular, but it also seems like he fundamentally doesn't listen. That he can be told again and again and again that the way to treat measles is not to get measles, is to get vaccinated. But spreading nonsense about vitamin A has just led to vitamin A overdoses in Texas kids. And instead of just following the science and telling people to get vaccinated. The measles is this epidemic is growing and spreading, and it is truly frightening. But the cuts that are happening, I can't even say that it's necessarily RFK Jr.'s fault or responsibility in that. The Women's Health Initiative, which is this groundbreaking study that's been around for decades, studying women in particular, because women are under-researched in medicine, and women are not the same as men. Our bodies react differently to drugs and treatments and everything else. And so this groundbreaking initiative for women was apparently cut, and Maria Shriver tweeted about it, and then RFK Jr. said, I'll look into it, or I'll take care of it. I'll make sure this isn't cut. And he doesn't know what his own agency is doing,
He doesn't.
or he's just straight up lying. It could be both.
But the Women's Health Initiative is very personal to me because it was actually one of my doctoral thesis papers. So I worked on the WHI data as one of my thesis papers at Harvard. So this is very near and dear to my heart, and I know all the principal investigators. They were my mentors a long time ago. But yeah, for example, a lot of the estrogen studies come from WHI. The fact that we know that aspirin prevents colon cancer, that came from WHI. WHI also calcium vitamin D studies, WHI. So many breast cancer studies, so many studies on mammographic density, on different treatments, estrogen receptor positive breast cancer. This is one of the largest women's studies on cancers, breast cancer and many other cancers. It's literally one of the richest studies in American history. In terms of NIH, there's so many studies cut, but this is one of the crown jewel studies in America. Women's Health Initiative. There's also dietary studies that also came out from this. This is like I said, this is the bread and butter for a lot of epidemiologists and nutrition scientists and cancer scientists out there. Which check. Once upon a time, I used to be, but American, one of the greatest things in America, people have always said, and this was traditionally bipartisan, is the NIH funds medical research at level billions and billions, like hundreds and hundreds of billions of dollars, and no other country in the world could even remotely get to that. And it disperses it to universities. Some are in-house, but the majority of dispersed to universities across the country, and has created like an amazing American innovation mecca. And this is why the NIH was traditionally the shining star on the hill, and now it's being decimated. It's being cut over a quarter, and the landmark studies, because it's not like just another dollar. You have to continue. Some of the greatest research comes from, cancer is a long-term etiology. It's not like, oh, put a dollar in, get an answer tomorrow, right? To get truly to find the cures and the preventions, you have to study it for decades and decades. But if you cut it off at the critical moment, we don't actually get the answer. So you can study cancer for 5 years, 10 years, but most cancers have an etiology horizon of 20 to 30 years. Like if I made everyone smoke cigarettes, bad idea, but hypothetically, you wouldn't see the cancer rates peak in the cohort of people for 30 years. And same with breast cancer. That's the horizon. So you truly want to prevent cancer and find the early detections, and how do we modify early detections? You have to do a long-term investment. And right now, a lot of the studies that we have invested, so it's not just like we're jeopardizing future studies, we're jeopardizing our investments over the last 20, 30 years too. We're canceling those investments. And that's what's so horrible. And that's what makes America great. So pharma loves to talk about, oh, our drugs, our scientists work so hard, and that's why we need to charge so much for medications. No, actually, most of the breakthroughs come from university labs funded by NIH. And then only then, ooh, this molecule can do this. Ooh, if you do that, these cancer markers or Alzheimer's markers change. Oh my God, maybe you can make a drug from that. Or, ooh, maybe you could create like a treatment, some sort of special treatment or improve care from that. And then you go out and then, ooh, let's do the last mile. That pharma does the last mile research to get the patent or buy a patent from a scientist and then profit from it. But for the most part, public tax dollars fund the research that create the next generation of drug discoveries and innovations, which pharma profits from. That's a whole different issue. Whether if this research was funded by the NIH, the general public should profit from it because we, the taxpayers, funded the research that eventually led to that drug discovery, that eventually led to you patenting it and then getting FDA approval to sell for billions of dollars back to us, right? It's a little.
Yeah, that doesn't feel good when you put it that way, Eric.
Sorry.
I've been tracking the chat, and there's some themes coming up here. Concerns about the personal medical records being accessed by the NIH, referring to concerns about the autism registry. And if you all know of any activist groups that are working on, pushing back on that, I think, people really are concerned about that. So if there are any.
I think, correct me if I'm wrong, Laura, I think the main thing is that they're not going to go into your private Kaiser Mayo Clinic data or your private medical records. But if it's in a federal database, like a VA, Medicare, Medicaid, these are federal data. And I used to do research on Medicare too, because one of the things, how we improve care in Medicare is, okay, we look at all these different people, and the Center for Medicare Innovation does like a little A/B testing. Maybe we should try this, or maybe try this. So they have database on like, what kind of treatments people get, what drugs are filled or drugs are prescribed to them, and various procedure data. So they have diagnostic and procedure data in the federal databases. Now, how they use that is the issue. So exempting yourself out of Medicare data or VA data in itself, it doesn't really solve or anything. But I think the problem is, of course, it's like, what is the motivation to use it? Because you want Medicare, like we want Medicare funded. You know, the seniors rely on Medicare, and by the way, fun fact: there is, America doesn't have universal health care. America does have universal health care for one disease. Anybody know? For those who have family members with it, you know it's ESRD, end-stage renal disease,
Yeah.
kidney dialysis. It doesn't matter if you are rich or poor. The U.S. government will pay for it. This is why you also see lots of dialysis centers pop up. But so there's U.S. provides a lot of care. I think the database, and we need the data, by the way, to do medical research, because a lot of by the way, in Europe, the reason Europe can find a lot of medical innovations from their databases faster is everyone's data and everyone's vaccination and everyone's activities are recorded and logged by the, it's a national health insurance registered, all your procedures. This is also, by the way, why we know vaccines don't cause autism, because all the European national databases on everyone who got vaccinated and everyone who got every single disease under the sun, autism does not increase. Actually, autism is actually decreased in the Danish studies of vaccines and autism. So and that's universal. There's no cherry picking or anything. It's the entire country's database that says, nope, there's no link with autism. But the US, so I think pulling your data out is not the solution. The issue is, of course, how you use it for evil. What I worry about is, right now, thankfully, we still have the Affordable Care Act. Like insurance companies, they can't jack the rates. Like, oh, you have family history of breast cancer, or you previously had cancer, you have high, genes for BRCA or something, that you can't raise the rates based on pre-existing conditions, thankfully, due to Obamacare. But if, for example, if they repealed that, then I worry about how health insurance, because right now you can buy, when you Google these cookies and all these tracking things on websites, by the way, your phone logs what you are talking about, so it knows a lot about you. All this is out there in a marketplace. Some people was like, this person might be pregnant, I'm going to market more pregnancy vitamins and other pregnancy materials to them. This guy is, might have cancer, I'm going to send him more things. But if this got in the hands of insurance companies, right, they're going to basically buy this data, and they're going to raise premiums on you based on how sick you are, or if they think you have a pre-existing expensive condition, and deny you altogether. So I think those are the kind of things I'm really worried about. But fortunately, we still have those barriers up, right?
Yeah. Those barriers are up to tilt. Yeah.
And as Frank just put it in the chat, they've already walked back this autism registry idea. And it's my understanding, somebody else shouted out Autistic Self-Advocacy Network from Ari from ASIN. It's my understanding that the people who proposed this registry were probably science types with good intent, because as Eric said, if you collect all this data, you can figure things out. But they were perhaps naive, or not thinking about the moment in which we live in right now, or who they report to, who their bosses are, that collecting the data could be a good thing in the hands of people that will use that information responsibly for scientific research and discovery. It could be a very bad thing if put in the hands of people that have an animus towards people with autism, and could be used to discriminate, could be used to target people. So I think maybe the people
pressed like autistic, like that would be bad. I think what really worries me is RFK Jr. This is one thing RFK Jr. does know. He hired this anti-vaxxer. And this notorious him and his father, I'm not going to say the name, him and his father basically for years have published anti-vax studies, which have been debunked many, many times. Many of them retracted. They lost their medical license and everything. board certification, and because of the anti-vax stuff. But that's who RFK Jr. just hired to do, guess what? A vaccine safety study. And it's interesting, it's already RFK Jr. at I think a White House or event said, "Oh, we'll have the answer. We'll have the answer of what causes autism by September." Like, who says that? Like, medical research never promises we'll have the cure or the cause of something by September. And of course, he hires these anti-vaxxers to scour the CDC data for it. And so what I want to tell people is CDC does have a surveillance system. They have it for COVID. They have it for many diseases. So a little anecdote is during the pandemic, what happens with the CDC data, it's a small data set. It's not a massive, because the US does not have a massive national data set like, these Nordic countries that everyone's enrolled. So it's like a limited surveillance data. And what happens is if you search for, say, COVID vaccine or MMR vaccine with an outcome and you data mine we call it p-value hacking, is eventually, because statistical significance means less than a 5% chance finding. But if you have run a gazillion findings, like look through 200 endpoints and 200 slice it two different ways about men, women, older men, younger men, older women, younger women, older men with diabetes, younger men without diabetes, all these different ways of slicing it. And for all these hundreds of diseases, you're going to have a chance finding. And Wheats once found a chance finding of the Pfizer vaccine an increased risk of stroke in older men in the CDC data set during the pandemic. So what we did in epidemiology is this real or not real? So we go verify. We go verify in the VA's data set. We go verify in Medicaid. We go verify in the UK data set, in the European Medical Association data set, in Israel's medical system data set. Do you find it? Nobody else found it. And so if no one else found it, and CDC found it by p-hacking all these different disease outcomes, then it was a chance finding. What I worry about is RFK Jr.'s anti-vax little consultants that he hired are going to p-value the hack out of this small limited CDC data set. And mark my words, I know what they're going to find. They know what they want to find, and they're going to p-value hack until they find a statistical significant result, publish that cherry pick result, ignore the fact that they p-value hacked a gazillion different ways of slicing the data. Look, I've spent 15 years in academia. I've published over 150 papers. I know how data analysis works. The cynical version is there's lies, damn lies, and statistics. But what a better way of saying, how the saying is correlation is not causation. The actual statement is correlation is not necessarily causation, but every causation is a correlation. The difference in knowing it is epidemiology and proper analysis. You have to pre-declare. For example, when you submit an NIH grant, say, we want to study the association of aspirin and colon cancer, aspirin and heart disease. NIH will not give you funding if you say, we're going to p-value hack aspirin with 200 different endpoints, and then give us some money, we'll find you something. Because you're going to find statistically something by chance that way. So you have to specify primary endpoint, secondary endpoint on these kind of clinical trials. And FDA does it as well. If it's not found on your primary or secondary endpoints, the results are considered exploratory and not as definitive. So you have to find it on your primary. You have to pre-propose it, find it on your primary, secondary. And if it's not found there, it's exploratory and it has to be confirmed elsewhere, right? And so, but I guarantee you they're p-value hacking the shit out of whatever CDC data set they're analyzing. And they're not going to go to Europe, Danish, British, Israeli, and Canadian data sets to double, triple, quadruple verify the results. They're going to p-value hack and publish what they have. And so I know what's happening in September.
Yeah. And so for the layman to understand like a p-value hack, it's basically, how do you describe that in a layman's terms? So
if you just flip a coin, like let's just you flip a coin enough times you're going to find, and let's just say your result is, I want 4 consecutive heads in a row, right? If you just flip it 4 times, the chance you get 4 consecutive heads is low. But if you flip it 100 times, 1,000 times, you might actually get 4 heads in a row somewhere in the series of flipping 1,000 times.
Yeah. So there's ways to run the numbers to
You
essentially
run the
get the
numbers with
results.
enough time. So what I do is basically, let's just say MMR vaccine. You want to study MMR vaccines association with autism. That's what they're looking for, or other vaccines in autism. But then you slice it, women, men, born in the U.S., born in the United States, born in got in the winter months, in the summer months, older, younger, and and then look at different slices of, high risk, low risk, family history, no family history. And so if you look at among each of these slices, you're basically taking one association and slicing it up into 20 or 40 associations where I just listed by the time you slice it. And basically you play with the numbers enough that you can find at least one of them might have a statistically significant. Remember, p-value of 0.05, which is the standard, statistical significance. It just means 5 out of 100 is 1 in 20. 1 in 20 by chance. 1 in 20. A lot of things happen 1 in 20 by chance. You do something enough times, you can get lucky 1 in 20 by chance, right? And so this is why we sometimes in science have a higher, like in physics, I think they need like 1 in 100,000, 1 in a million chance before they believe it. But what happens is if you run it against 100 disease outcomes and each correlation is sliced up in 20 different ways, 20 times 100, it's like 2,000. You're running 2,000 different correlations. You're going to find something. And if you cherry pick that without telling you everything else you ran, you say, we found a correlation with this and this, you're going to find it. And this is why if you find it from this p-value hacking, we call it also data dredging. You dredge until you find something, right? And then what you traditionally do is you do confirmation. You confirm. Does anybody else see it? If nobody else sees it, it's not real. Because if it's true, you'll find it elsewhere, right? But this is what they're going to do. This is why you hire a consultant who is like biased towards you. We see it in nutrition epidemiology all the time. Like the meat industry would love to prove that red meat doesn't cause heart disease, and mortality or increased risk of cardiovascular things. So they basically fund all these different studies to chop the results and slice and dice whatever they want to get the results they want. This is why funding disclosures are really important, but also you have to understand like peer review and this underlying person's motivation. One study does not prove it. You have to confirm it with lots of other things. And if they all confirm it, like if they find something interesting, great. I would say go every other country in the world that has the same data, confirm it. If you don't find it, it's worth jack shit.
Right.
But
so
they're going to PR the shit out of
summary,
it.
if we're hiring an unqualified, severely biased principal investigator, someone who's, they already know
a long history of anti-vax debunk studies.
So it's very concerning. That's the summary there. So before we wrap up, I think we should just touch upon that measles is in fact continuing to spread. And the best way to prevent that is to advocate for the MMR vaccine. I don't know if there's any other comments or knowledge about that spread.
Laura, did you see what FDA commissioner the other day said? He said, no. I support the MMR vaccine. But then the anchor, I think it was an MSNBC anchor. So are you telling parents to please vaccinate their children? And he gave like this very repetitive, like robotic answer. I support the MMR vaccine. But can you just tell the audience, their listeners, will you tell them to go out and get your kids vaccinated? And he was like, I support the MMR vaccine. It's like they play this like footsie, like, it's like a footsie with the anti-vaxxers where they stand on the, say, I support the science on this, but they don't say go out and get it. It's like, it's a dystopian world where we live.
Yeah, and it's same with RFK hearings where he just wouldn't say the words,
Right.
get vaccinated. And even on his PR tours, his anti-measles PR tours, where again, he'll say things like, I support the vaccine, but he doesn't say, go get your kids vaccinated. It's horrifying.
I know.
Yeah.
This is why we're in a rudderless, we truly are in a rudderless times. I just pray we don't have, I pray to God we don't have bird flu. We don't have anything else. Pertussis on the rise.
Yes.
I hope polio doesn't come back. Measles,
Yeah.
hopefully we keep it contained, but my outlook's not great. So,
well, yeah, like here at the WHN, we're continuing to do our best to share proper, reliable, accurate, scientific information. So if everyone could make sure to follow and interact with our social media posts, as we all know, the algorithms work the best when there's the most activity on the posts, and we would like to reach as many people as we can. I'm a parent now, and I do see a lot of concerned parents about their children this past year getting sick, the immune system's being overly taxed, and we just need, there are plenty of people that are still willing to listen if I feel like if the right information passes them by. So we do all need to do our part with sharing the accurate information. So thanks everyone for tuning in today and joining us. If you have suggestions or areas of interest for future town halls, please send me an email at katie@nexi.edu. And if you haven't joined our WHN network yet, I welcome you to. We have advocacy campaigns and different initiatives, all different types of projects that can be worked on to try to combat all of this misinformation that is spreading also rapidly. So just please do join in. And we have a great supportive community as well. Thank you, everyone. Again, thank you, Eric, and thank you, Laura, for your time today. So much appreciated. And have a great and safe afternoon or evening or morning, as some be in all different time zones. All right. Take care, everyone.
Thanks,
thanks,
everybody.
Kate.
Thank you.
Thanks,
Thank
Laura.
you. Bye.
Bye-bye.